Hi, welcome back to Pula Med. Today's topic is on hepatitis B. So let's go ahead. In introduction, we are going to mention about hepatitis B surface antigen, also called HBsAg, Australia antigen, which is persistently being present in the blood in cases of hepatitis B infection. Hepatitis B infection is also leading cause for the liver transplantation. Hepatitis B is caused by the etiological agent hepatitis B virus, and this agent is going to be in its complete virion form, which is nothing but called Dane particle, containing envelope as well as core. The genome is circular double-stranded DNA. Next comes the diagram of hepatitis B virus. We have envelope containing HBsAg, core containing HBcAg. We also have HBeAg, and then nucleocapsid, which is depicted in sky blue here, also DNA polymerase and double-stranded DNA. So this is completes the diagram of the hepatitis B virus. Then comes flowchart. Hepatitis B virus enters hepatocyte. Uncoating of the virus happens. Nucleocapsid gets released, and so does HPV DNA. This DNA gets converted to CCC DNA, and CCC DNA goes into the genome of the host. Now it has two fates. One is it can continue in the next generation daughter hepatocytes as CCC DNA, or otherwise it could generate RNA. This RNA can synthesize virion particles, which form nucleocapsids, and once these nucleocapsids are mature enough, they get packed in along with HBsAg and are exported as virions. So this is the flowchart which you are supposed to mention in the exam. Transmission is via exposure to blood or bodily fluids, perinatal transmission, transfusion-related transmission, parenteral drug abusers, as well as unprotected sexual intercourse, practices like acupuncture, body piercing, and tattooing, and even sharing of toothbrushes and razors. This also could transmit the infection. Clinical manifestations for acute hepatitis would be fever, nausea, vomiting, anorexia, jaundice, as well as right upper quadrant discomfort or tenderness. Even sometimes the patient can present with chronic hepatitis, like decompensated cirrhosis, where the patient can have ascites, jaundice, bleeding manifestations, hepatic encephalopathy, or sometimes incidentally diagnosed with hepatocellular carcinoma, or even with extrahepatic manifestations like glomerulonephritis, aplastic anemia. So the presentation varies. Lab investigations would be elevation of aminotransferases, both AST and ALT, which could be as high as 8,000 to 2,000. There can also be elevation of bilirubin, hypoalbuminemia, prolonged PT, as well as INR, which are usually seen with cirrhosis. There can be elevation of ALT for more than 6 months that could indicate progression to chronic hepatitis. And usually in acute and chronic hepatitis, we are going to have HBsAg positive, but IgM is going to be positive in acute cases, whereas IgG will be positive in chronic cases. And HBeAg indicates infectivity. Similarly, we can also do HBV DNA viral count that can be used for quantification of viral load that is present in our body. Treatment for acute infection would be supportive, mostly IV hydration, paracetamol for fever. In case there is severe illness or prolonged illness, we tend to go with antivirals like tenofovir disoproxil fumarate or tirofilavir alafenamide or entecavir. In cases of chronic hepatitis, especially when the age is greater than 30 years, persistently abnormal ALT along with HBV DNA copies of 2000 international units per ml, we go with antivirals, TDF, TAF as well as entecavir. We are going to decrease the viral load to as least as possible. That should be our aim. We usually prefer TAF over TDF because TDF is like more nephrotoxic. Complications would be cirrhosis, and hepatitis B is one of the leading causes for hepatocellular carcinoma. And prevention, we are going to give purified recombinant HBsAg vaccine, which would be given ideally for all newborns within 24 hours of the life. And second, we are going to give it in the form of pentavalent vaccine in immunization schedule. In those who do not receive birth dose vaccine, they can get immunized in the form of 0, 1, and 6 months. And vaccination is very important for those people who are healthcare workers and who are going to have high risk sexual behavior, as seen with men having sex with men, and even multiple sexual partners, and even those who are in very close contact and who are requiring more blood transfusions, as in thalassemia, and even those with chronic diseases like diabetes, HIV, CKD, CLD. These people will be needing vaccination. And in pregnancy, we are going to give hepatitis B immunoglobulin, especially when there is high viral load or HBeAg positivity. And we also tend to give antiviral therapy, TDF, in third trimester in order to reduce the chance of perinatal transmission, especially when there is high viral load. Thank you very much. Do subscribe, share, like, and comment on what more you want